Welcome back. This is Morning Express here on KTN. Today is the 14th of July 2014 and I'm Joy Doreen Vera, just about to speak to a number of doctors who are joining us in studio, or specialists I might call them, and of course with warriors, sickle cell warriors in studio with us, and welcome with me set of guests this morning. Good morning, and it's good to see you all.
Good morning.
All right, we have Dennis on my immediate left, Dennis, and then we have Leah right next to Dennis, and then we also have Dr. Rajab, who is from Lancet Pathologists Kenya, and we also have Dr. Kohli, who is also from Lancet Pathologists Kenya. Then they're here to discuss sickle cell anemia and what we need to know about this disease or this condition, and how it can be treated, how it can be managed, and a whole lot more about what we don't know that we need to know about it. So welcome all. And I hope we had a wonderful weekend, knowing today is Monday. No Monday blues at all.
No, not at all.
All right, I'll start with Dennis. Dennis, you are a warrior, a sickle cell warrior. Tell me about it. How did it start? When did you actually know that you were going through this condition, and at what age?
Okay, it was known when I was about 3 years old. All that while, they had not known what was wrong. They were telling my parents it's malaria. And finally, when I was around 3 years, I went to another doctor who told them that it's not malaria, it's sickle cell anemia. That is when now I was put on medication.
So from the age of 3 up to today?
Yes.
How old are you now?
I'm 25.
25.
Yes.
Great. Leah, let's hear from you. How long have you had the condition?
As Dennis said, I was, for me, my family, I had elder sisters, they had sickle cell. So my parents got to know that I have sickle cell at 6 months. So I have been able to live with the disease for 25 years now, and it's not such a burden as people think it is. And I'm very, very, very happy to have this platform to speak about it.
Right, so it's genetic.
It is genetic.
Is it genetic as well for you, Dennis?
It is genetic.
Yeah, any other family members?
We have 4 children, but I'm the only one who has it.
You're the only one who has it. All right, so I'll now get to Dr. Kohli. Dr. Kohli, what can you say about sickle cell anemia? Does it have an origin? I know that Leah has said it's genetic, but let's talk about the disease itself. Does it choose its patients, or does it choose the people that it actually gets to, or is there just a mysterious, set of cells that we are looking at in the body system that do attack the body?
Actually, as pointed out, it is a genetic disorder. So it's very common that siblings will have it and will have similar types of symptoms. However, not everybody has to have inherited both the hemoglobin S gene. So some of them may not have SS, they may just be carriers of the disease, so they may be AS. What actually it is that we have hemoglobin in our body, and hemoglobin is made up of proteins, and proteins are further made up of building blocks. So if there's an abnormality in the way the building blocks come together, or if they don't come together in the right pattern, then one can have an abnormal structure of hemoglobin, which can result in production of hemoglobin S, which is the sickle hemoglobin, and then patients can actually get either the anemia, which is they inherit both S's from both parents, so they're HBSS, or some of them may be traits whereby they have AS. And depending on whether you're SS, i.e. you have sickle cell anemia, or you have trait, your symptoms will be different, and the severity of disease will also be different. So how you present, at what time, at what age you are diagnosed will all be different.
So more than 50% of it is inherited?
Majority is inherited.
Yes. Right.
Yeah.
So what are the conditions that promote the sickling or the distortion of the red blood cells in sickle cell anemia?
Okay, because it's a genetic defect, there's a difference in the way the protein blocks come together. So you have HBS, but not everybody is in a sickling crisis all the time. So they are precipitants to the disease. So if somebody has SS and maybe they're exposed to precipitants such as dehydration, or they get an infection of some sort, or the body acid builds up, the HBS in the red cells starts sickling, and that's when they start having their symptoms of pain, joint aches, enlargement of their spleen. Basically, the red cells are being destroyed, and you get symptoms of sickle cell anemia.
Right. Dr. Rajab, if I might come to you, Dr. Jamila Rajab, what or how is sickle cell anemia diagnosed when it comes to the diagnosis? What are some of the facts that we need to know?
Actually, the first way sickle cell is diagnosed is actually from the parents who realize that they have this child who seems to be having problems. For example, they will always have a low level of what we call hemoglobin, what people would say that it's low blood levels, and these children get tired quickly, and for example, if they're very young, they may not be able to breastfeed properly, right? So usually it's the parents that notice that my child has something wrong with them. And secondly, they will get repeated infections. They will come with upper respiratory tract infections, pneumonias, and the parent will realize there's something wrong, and they present to a health facility. The first symptoms, of course, are of the low blood levels. So the children get tired very quickly, and when the doctor examines them, they're pale because their hemoglobin level is low. There are several laboratory tests that we can do. It's actually very simple to diagnose sickle cell disease. A medical provider, health provider, will just almost diagnose it from the symptomatology or the symptoms that the victim has. They'll be pale, they will have yellow eyes, and usually what we call jaundice. And yellow eyes is because of the destruction of the red cell because of this abnormal protein, the hemoglobin protein. And when it's destroyed, there's a pigment that builds up in our body called bilirubin that stains the eyes yellow and the palms. So when you look at the patients have yellow eyes. And remember, it is inherited. So most patients present very young, like you've had. The presentation was 3 years and the presentation was 6 months.
6 months, yes.
Yeah, so usually it's very easy to diagnose, even from the symptoms that the patients come with. A very simple laboratory test where we take the blood and just look at it under the microscope. You see the abnormal red cells. Our red cells are usually round, but for the sickle patients, they form a sickle, right? And that's how it was, that's where the name comes from, sickle cell anemia, because the red cells form a sickle. And you can see that under the microscope, a very simple test that can be done in any simple laboratory. Obviously, there are other tests that we can do that actually tell us how much sickle hemoglobin the patient has, and that's important for treatment. And that's called hemoglobin electrophoresis, where we actually look at the protein of the patient, and we can be able to tell that this patient has a sickle hemoglobin as opposed to the normal one, which is called hemoglobin A, that you and I have. Yeah.
Great. Leah, what has it been like, growing up with sickle cell anemia? I know there's a lot of myths that people do have. The society have all kinds of myths about sickle cell anemia. What has it been like for you, 25 years?
Okay, basically for me, the structure that I was raised upon was very supportive. But now when you go outside, people are wondering why your eyes so yellow, why are you so skinny, why are you always so weak, you're not participating in activities that are very strenuous. You tell them you have sickle cell, so most of the people don't have any idea what sickle cell is. So you have to get into the discussion of explaining what sickle cell is and how it comes about and what are the symptoms. And basically the notion out there is that people with sickle cell cannot live beyond the age of 16.
Yes.
And I was told I will not be able to live. When I was younger, I was told I will not be able to live beyond the age of 9. When I reached 9, I was told I was not going to be able to live beyond the age of 16. Now I've been told I will not going to live beyond the age of 25. So I don't know who set the time gap for sickle cell patients, but it's basically total misconception, because it depends on how you manage the disease. The more knowledge you have and the more information you have from your medical practitioners and the research you do is going to help you manage the disease better.
Right.
For me, it has been a great process. This research is growing, and the process has built the capacity for me to know what is good for me and what is not good for me, to help to lengthen my life. Yes.
Great. So you say, there's been all these myths about your life expectancy, and then, they said it was 9, and then it moved up to 16, and now you're 25.
Yes.
How does it feel now that you're 25 and you've gone through all these phases of people saying, you're not going to live beyond the age of 9, you're not going to live beyond the age of 16? What does that mean for you?
For me, it means that it doesn't matter what people say and what the statistics say. Actually, it is how you are able to accept the condition and be able to manage it. If you do not accept it at first, you see it as a burden, you see it as a curse, or all the other misconceptions out there, you will not be able to manage yourself very well emotionally, psychologically, and health-wise. So for me to be able to accept this disease from a very young age has been able to give me the strength to be able to surpass all those life gaps I've been given. Yes.
Interesting. All right, Dennis, I'll now come to you. You've had sickle cell anemia since you were 3, and you're also now 25. I'm sure there's been a lot of myths about your condition, and knowing that you are a male, or you are a young man, the situation might have been different for you. Normally a male, a young person is always super active. They're always participating in all kinds of sport activity and all that, extracurricular activities. What has it been like for you?
Okay, it wasn't easy for me when I was a small, very young boy in school, because most of the time people used to do a lot of things, like people would go play football, and I will be sidelined and told, you cannot do this because it's not good for you. Yeah, so I always felt so bad, because there were a lot of things that the doctor advised me not to do. But growing up, it's just the management, like Leah said. When you manage yourself very well, you can do a lot of things. Surprisingly, I've been able to do a lot of things and that I wasn't able to do when I was small. And it's not about what people tell you. It's about yourself. You should know your body, know what you're able to do and not what you're not able to do. And know how when to take your medications, know when to see your doctor. Everything will be okay.
All right, so how often do you take your medication?
There are medications that I take once in a while, not every day, like hydroxyurea. They advise that we take every day, but my body, it's different for me, because I think sickle cell patients have, their bodies are different. What I experience is not the same thing that Leah will experience. Yeah, so my body, according to me, how I take my medications, I take them like there's this hydroxyurea I take one on Monday, there's another one I take on Wednesday, and another one on Friday. But there are people who will take them on Monday morning, Monday evening, Tuesday morning, Tuesday evening, every day, in the morning, in the evening. That is how it is prescribed.
Great.
Yeah.
All right, let me get back to Dr. Ruchika. How do you think, let me start by talking about the survival rates. They've talked about the different myths. One was said, you're not going to live beyond 9, 16, 25. But what are the survival rates for sickle cell anemia patients?
Okay, as it's already been said, it is a myth that at 9 years you'll expire, or 25 years. We have patients here in Kenya who are in their 50s and 60s. And in the West, patients are living comfortably up to the age of 70. So they're leading a relatively normal life with sickle cell disease. So in the past, yes, there was this uproar that if you have sickle cell disease, that's it, you're going to die in infancy or you're going to die during childhood. But there has been a lot of medical advancement, and not only medical advancement in terms of management, but also in terms of diagnosis. Children are getting diagnosed much younger, and treatment is being offered to them much earlier. And also, I think education. They're also aware of what the disease entails by like they've mentioned, what they can and cannot do, what regular follow-up means, and how they should take their medications also on a regular basis. In terms of medical advancement, of course, as we monitor the disease, we just don't monitor the symptoms anymore. The problem is the amount of HbS that these patients have in their blood. So we try and keep that to a minimum, and that can be done through medication like hydroxyurea, or it can be done through blood transfusion, either preventative blood transfusion or what we call exchange transfusion. Gene therapy is being investigated. Some patients who have donors are also able to undergo stem cell transplant. So in terms of medical intervention, management, diagnosis, we've really come a long way. So life expectancy has improved.
Great. We have an SMS here. Someone is saying, I'm 30 years old and a sickle trait. And he's saying, I was told my time limit is not beyond 21 years of age. My concern now is, can I give birth? Dr. Jamila.
If they're a sickle cell trait, it means that they are just carriers. So they should actually be able to live a normal life. Carriers usually live a normal life because they have, they're carrying the abnormal hemoglobin S gene, but they have the normal hemoglobin A, which protects them. So they should be able to live a normal life. And she can actually give birth, yes.
All right. For most Kenyans who really cannot afford treatment when it comes to sickle cell anemia, how affordable is this treatment, and what is the best way that they can administer it?
Actually, the treatment is actually not very expensive. For example, in our clinic that we have in the public hospital, the medications are actually available at a subsidized rate in the public hospitals. There are 2 or 3 major medicines that the sickle cell patients need to take on a daily basis, or like Dennis said, regularly at certain intervals. There is we give them what is called folic acid to help them build up their blood. Then there is hydroxyurea that minimizes the complications of the sickle hemoglobin so that they don't get organ damage. And then there is one which prevents infections, because usually infection is very common in sickle cell disease, and usually sometimes it is the cause of death. So but as we say, the best thing is education. We always tell the parents that if you have a child who has been diagnosed with sickle cell, every time they have a symptom, however small, should bring them for health care, right? And the survival rates have increased, just like Dr. Coley said, because of the health care. And it's constantly shown that patients who have regular, ready, available health care will, of course, have longer survival rates.
Right. And another SMS with someone who doesn't leave their names. There's someone here who is saying there's a supplement called Dioscovite, and it works, but it's only in America, Nigeria, and Ghana. It helps patients have a normal life. My question is, why don't doctors look at it and guess they want people to keep going back mostly to private hospitals? Is there a specific medication? And by the way, have you even heard of this treatment at all? The supplement?
Okay, there are many supplements that many patients are trying. We do get all those questions and all those comments. They say, oh, they are using this supplement in Nigeria, they're using this in Jamaica, they're using this in the United States. Most of them are supplements that tend to reduce the sickling process. And what needs to be done is that all these supplements need to be studied by the experts, and we need to do what's called clinical trials to see whether they actually offer advantage or give or reduce the complications of sickle cell disease. One thing we have to understand is that, like Dennis said, sickle cell disease is a spectrum. Patients present differently. Some patients may not have as many complications or crises, as we call them, as other patients because of the genetic makeup. So you may find a patient who is taking a supplement, but inherently they actually have mild disease. They don't have sickle cell, but they have mild disease because of the difference of this spectrum of the disease and the number of complications they have. So they may have this perception that this particular supplement is working for them, but it may not work for others. So what we need to do is find a supplement that has passed the clinical trials as on scientific basis to show that it is actually beneficial for sickle cell patients.
Great. Francis is saying, I've been a sickle cell warrior for the past 31 years. A great topic this morning. Well, thank you, Francis. Now, as we wind up, in the interest of time, what would you like to say to sickle cell warriors out there who are watching, and some of them who have been told, you're not going to live beyond the age of 9, which is definitely a myth? What would you like to say to them, Dennis?
I'd like to tell them that sickle cell is not a death sentence anymore. These days there are better medications, and there's a lot of research you can do on sickle cell to help you live a normal life. No one should tell you anything that, no one should give you a life expectancy and tell you that you will not go beyond 15 or 18. It is not up to them. It is God who knows when you were born and knows when He'll take you.
Great.
Yeah.
Leah?
For all the sickle cell warriors out there, it's I know most of us rely on our parents so much for the information and for the knowledge and for the help, but it is a great way to deal with the disease if you take initiative and do the research on yourself and do the research on the disease and find out what works for you and what doesn't work for you for the things that you want to do in your life. Because personally, I have found a way to live without the medication and prevent the crisis from happening. So for me, through this research, I've been able to identify what works for me and what doesn't work for me. Also, you should get a support group out there for people suffering with sickle cell, people who are giving you stories of power, giving you knowledge and information to help you sustain yourself and manage this disease. So don't hide behind the shadows. Come out and speak up about sickle cell. A lot of Kenyans don't know what sickle cell is. If you tell them, that they are better able to understand you.
Thank you. And we'll have your final remarks, Dr. Jamila Rajab.
I think it's important. Awareness is important. Doctors that come into contact with families that are afflicted with sickle cell should give them as much information as possible, share with them what the complications are and what they're able to do to avoid these complications. So awareness is very important. There are several support groups in several health institutions where patients come together. We bring patients together. Like, for example, when I diagnose a sickle cell patient, I always refer them to a support group because they can exchange information. And for example, like Helen said, they can share what the latest is in the management and how to learn your body and know what works for you. Parents, of course, are very important because a lot of sickle cell are young children. The parents also need to know that there's no stigma about sickle cell disease because some of them tend to think it's a stigma. They hide the fact that there's a family history of this because there's always a family history. So awareness is very important and something can be done, and they should come out and say that they have sickle cell, and we can tell them that when they're pregnant, the chances of them getting a sickle cell child is this, and this is what they can do about it.
Fantastic. And finally, Dr. Rishika Kohli, what are your final remarks as we wind this up?
I actually agree with everything that has been said. Education is so important. I think it's every healthcare provider's responsibility as well to ensure that if they are faced with a patient who has sickle cell, they must talk to them and tell them what does this diagnosis mean, what does their future entail in terms of frequent hospital visits, medication, sometimes lifelong medication, taking medication on a daily basis, encouraging patients to talk about their issues, coming to hospital and making sure they make their clinic visits on time, because trying to assist yourself without support or without expert advice can sometimes lead to more complications. There's a lot happening in the medical field in terms of advancement in diagnosis and management. So, very soon, I hope in your next Morning Express show, you'll have sicklers who are 70 years here.
True. Yeah. I'm looking forward to that, actually. And in studio, we've been hosting Dr. Rishika Kohli and Dr. Rajab Jamila, who are both from pathologists, that is Lancet Pathologists Kenya, and they were here to enlighten us more about sickle cell anemia. We also have sickle cell warriors in studio, that is Dennis and Blair. Thank you all for making it on the show and for enlightening the public about sickle cell anemia. I'll just wind up with the SMSs here. Hi, I'm a sickle cell, but I experienced the crisis twice since I was born. That's 2010 and 2013. I have never used the drugs until 2013 when I started using the folic acid, but not regularly. And the problem is that I don't know if I'm a carrier or a victim because the doctor never told me. And now I'm 28. Can I have a child? I think that question about children was answered earlier. And also we'll look now at someone here who doesn't leave a name. Oh, this is Charles. I've been a sickler for 25 years. My question to the doctors is, what are the chances of a sickler surviving after the spleen becomes functionless? And my brother had lots of crises lately, but we have tried to manage. He's now 21 years, and there is a sickle cell, and is there a sickle cell association? And someone else here, Wanjiku, is saying, I have a son who is a carrier, and he was tested at birth in the United States. I'm surprised in Kenya parents have to watch the symptoms and know that their children have sickle cell anemia. Well, thank you all for the feedback. I cannot take it all, but would like to appreciate the time taken for you to know more about sickle cell anemia. I'm Joy Bira. Join us again tomorrow with James Smart, where we'll be having yet another edition of Morning Express. Have a good day for now, and God bless you.